Thank you very much for joining. We're very excited about the 7 steps to choosing an EHR, which will be presented by Laurie Morgan. And again, my name is Christina Cusamanio. I'm with Quest Diagnostics, and I am the Director of Marketing here. Laurie Morgan, who is joining us today, is a senior consultant and a partner at Capko in Morgan, and her consulting focuses on helping practices generate and capture more revenue and operate more efficiently. Laurie is a veteran of the technology industry, and she is especially interested in how innovations in EHRs and practice management systems can help practices streamline their workflows, reduce organizational stress, and improve profitability. Besides her consulting work, Laurie is also very well known in her speaking and her books. She's an author. She has an ebook series, Management RX. It includes the popular titles, Patient Flow Mistakes Smart Managers Make and How to Avoid Them, Get the Best from Your Medical Billing Service, and The Quick Guide to Online Physician Reputation Management. Laurie has a degree in economics from Brown University and an MBA from Stanford University. We at Quest Diagnostics, Care 360, chose Laurie to present to you today because of her expertise and her work with medical practices over the past 20 years. So with that, I'd like to turn it over to Laurie.
So welcome, everybody, and thank you so much for the great introduction, Christina. And I just want to take a few moments to go through our agenda before getting started. I'm going to walk you through the 7 steps presentation, and basically the idea here is that these are my 7 recommendations for steps you can take to make a good choice for your next or your first EHR. And then after I'm done with my talk, we're going to have a brief presentation from Care 360, and they're going to tell you a little bit about their products, and then we'll move on to our Q&A. So if you have a New Year's resolution to switch EHRs or to adopt one for the first time, there's a lot of good news. First of all, if you're a switcher, you've already learned a lot about what you like and what you don't like. And in our practice management consulting business, my partners and I, of course, have learned a lot as well, and that's part of what we're going to be sharing here. The great thing about having that experience is that it makes it less likely that you'll make a choice you're unhappy with in the next go-round. But, of course, it's really important to apply that experience in a disciplined way, and that's what these 7 ideas I'm going to share with you are all about. Another great thing about switching is that you do have a lot more options to choose from that are likely to be a good fit for your practice. Some of the weaker players have already been weeded out of the market, and it's become more competitive, and everyone remaining in the market has really had to up their game a little bit. So you'll have more good options to choose from, and they're also competing by offering more features that your practice can use. And then, of course, the other thing is that you're really in good company. Software Advice last year found that 59% more practices with EHRs were looking to switch to new ones than had wanted to do so in 2014. So there's a lot of activity in the market, and that means that the vendors are, as I said before, they're stepping up their game, and they know that there's business out there to be had, and so that's opportunity for you to get better service and get a system that you're happier with. So, of course, the number one thing that you're probably all already concerned about, though, is that if you're thinking about making a switch, whether switching EHRs, especially if you're switching EHRs, but even if you're switching from paper records to an EHR, you want to make sure that you're not jumping out of the frying pan and into the fire, and that you're able to make a good choice so that you don't feel like you have to make the switch again a few months down the road, or a few years down the road, rather. So that brings me to my first step, which is really related to that idea of staying out of the fire. And it's really important to take the time to thoroughly analyze your current system so that you can understand what actually went wrong, and why you were either never happy with it or why you're no longer happy with it. And I wrote here this phrase, too many clicks, and I'm wondering if some of you have heard this from your clinicians, because this, of course, is one of the main complaints that we hear, that the system just requires too many clicks, everything takes too long. And, of course, that is has a huge impact on workflow, but it's not a very specific comment. So you need to really dig a little bit deeper. The other thing is that sometimes when practices look to switch technology, they don't think about what they like about their current system, especially if you become really unhappy with it. It's easy to get hung up on just the things that are dissatisfying. It's really important to make note of the things that you like, because if you make a switch, your new system doesn't have those things that you really relied on, then you're ultimately probably going to be unhappy with that new system as well. It's also really important in doing your upfront analysis to make sure everybody's included, not just the clinicians. Now, an EHR is, at its core, a clinical system for tracking electronic medical records, but it actually touches on almost every area of the practice. And even though the clinicians may not participate directly in the process of, say, billing and getting that needed claims information, when that part of the operation doesn't move smoothly, it actually ultimately affects them as well, not just financially, but also in terms of interruptions and being asked for more information. So it's really helpful to get the insight of everybody in the practice who actually relies on the EHR, not just the clinicians who are the primary users. And to that end, you really want to make sure you make it easy for everybody who's involved in giving feedback to contribute that feedback. So to that point, now this slide is a little bit hard to read, but let me just explain to you what it is. This is a system called OneNote. And if you are a user of Microsoft Office, or especially if you have Office 365, you probably already have this product for free. And it is a wonderful tool for collaboration. If you're the practice manager, for example, and you're tasked with leading the exploration of options for new EHR, and you're trying to get everybody to provide their feedback, it can be challenging, because sometimes when you ask people, what are the things you like and what are the things you really dislike about our current EHR, they may have a hard time remembering everything that comes up, in the course of, a month or two of actually using the system. And so this is a way for your team members to be able to note the things that they like and dislike in real time. The coolest thing about OneNote is that basically you set up a notebook for a particular project, and you give the people you want to contribute to it access to it. And then when they're in the middle of doing something on the EHR system, they can actually print what they're seeing. If it's a report that doesn't give them what they need, or they can print their screen right into OneNote. So it's a simple process, and the system also makes note of who actually posted the information into the folder. So you can keep track of everybody's feedback and all the issues that are raised in an easy-to-use way for everybody, and let people make their comments when they're actually experiencing the problems, or on the flip side, the things that they really like about the current system. Let's let them do that in real time and then capture it all in one place. So I mentioned about the too many clicks, right, how so many clinicians boil their dissatisfaction with an EHR system down to that one sentence, but you really have to try to dig in and analyze a little bit deeper. Too many clicks and templates are no good. Those are the kinds of things that often go together, and sometimes it's just a matter of not having gotten the right support from your current provider, or the system never having been set up correctly. So it's really important to dig a little bit deeper and go below this type of very high-level feedback, because on the flip side, when you go out to shop, it's hard to tell a vendor, we're looking for a system that doesn't have too many clicks, right? It's hard for the vendor to respond, to that kind of very 30,000-foot sort of feedback. Similarly, a lot of times we'll hear, well, this particular EHR doesn't have many features. Well, it's really important to isolate what features you want, because there are many EHRs that have loads and loads of features, but they may not be the things that are most important to your practice. And similarly, we hear, that the system is too expensive. One of the big challenges with preparing to look for a new EHR is that you have to analyze costs that are usually calculated in different ways. Some of the newer cloud-based systems, one of their big advantages is that you don't really have to invest in a lot of in-house technology. Instead, you will pay a monthly fee, which can be a lot more in many cases can be a lot more affordable, but you have to make sure you're comparing apples to apples, because sometimes you look at that monthly fee and you think, well, if we just bought our system, we wouldn't be paying this monthly maintenance fee, this monthly license fee. You have to really look at a full year or even a full 5-year budget for what the systems are going to cost you to really factor that in. So the next step I want you to take, or that I recommend that you take, is that you try to consider both your current and your future needs. And the reason for that is I'm guessing that many of you on this call once really liked your EHR. It's only recently that it started to disappoint you potentially, right? So, if at some point you love the system, but 2 years down the road it's starting to disappoint you, well, that's, unfortunate, right? Because you don't want to go through this whole disruptive, time-consuming process of choosing and then converting to a new EHR any more often than you have to. So you want to try your best to project out into the future and think about what some of the things are that you might need. So, some of the things that many of the practices we're working with are thinking about down the road, of course, meaningful use. I mentioned that because many practices in the past found that their systems weren't able to keep up with them on meaningful use. And so that was a reason to, have to make a switch, depending on where you are in meaningful use at this point, and also depending on where the meaningful use program goes. You may want to talk to the different vendors that you're considering about their readiness for what's coming down the pike. Then there are other things that, many practices find important, and many practices have on their 5-year strategic plan that they want to look at. For example, care coordination, adopting a chronic care management program, or converting your practice to a patient-centered medical home. These are big initiatives, and you really want to make sure that any EHR technology that you're choosing is going to be able to support that. And in many cases, you may not need them to be ready today, because maybe you're not ready today, but it's on your list for 1, 2, 3 years down the road. You want to make sure it's on their list for 1, 2, 3 years down the road. Most technology companies will have a roadmap of what they're planning to roll out over the coming years, and you want to make sure that if these types of programs are on your roadmap, they need to be on your EHR vendors as well. Other things that kind of fall into that category: telemedicine. Many practices are thinking about doing that. Will your EHR support it, or just simply be able to interoperate with an add-on technology that can support telemedicine? Also, are you going to be extending your team? That really factors into your cost, right? You need to know what's involved if you're going to be adding 1 or more clinicians to your team. And then finally, many practices look ahead and they think they're either going to move their billing in-house or they're going to move it to a billing service. Both of those things can affect your EHR decision. And you want to put that on the table as you're talking to vendors. So related to the billing is step 3, which is in addition to clinical programs and revenue-generating programs that you want to make sure your EHR supports. When you're making a big switch like this, it's also an opportunity for you to consider changing up some of your infrastructure, right? This is such a big project. It's the perfect time to consider some other big initiatives that you may have been putting off because they would have involved actually making big technology changes. So, for example, if your billing and EHR systems aren't integrated, this is a great thing to put on the table as you're shopping around for an EHR. Similarly, mobile access, this is something that almost all providers want, and more recently we see patients really wanting more mobile access, and it's becoming more of a competitive strength for systems that can actually deliver that, especially as millennials are aging, having children, et cetera. They're really driving the use of smartphones for almost every aspect of managing life, and so it's very important that your portal, for example, be able to work really well with mobile systems. And then, are you thinking about moving to the cloud? This is something that's on the mind of a lot of practices, and choosing a new EHR is a great opportunity to make that jump if that's something that's been on your list. And then, there are also third-party solutions out there, especially for the front office. collecting from patients has become so much more challenging, and understanding patient financial obligations has become such an issue for the front office. And there are many different add-on solutions that can work with both your EHR and your practice management system. And you just want to be sure that, anything that you're thinking about using is going to work compatibly with new systems that you choose on both the EHR and the practice management side. So the next step that I recommend is to create a requirements document. And this is, in the old days, we used to refer to this as an RFP, and I think in some very large environments, big corporations probably still do this. The smaller companies don't do this sort of formal process as much anymore. But I want to recommend that you take a look at creating a document that's like that, even if it's not specifically an RFP, because it's a really great discipline for organizing your priorities and for organizing all the feedback that you've gotten. What are the essential things, the important things, the nice-to-have things, the deal breakers, and the things that you're willing to compromise on. Creating a single document that stores all that information and that you can share with prospective vendors is a great way both to inform them of what you're looking for, but also just kind of manage the process internally. It's sort of like people often talk about business plans as something that people write when they're starting a new organization, and then they end up sticking it in a drawer, and the question is it really valuable? Well, a big part of the value is the discipline of going through that process. And you can modify it as the world changes and things roll out differently than you expected. And the same is true for your RFP style document, right? It becomes your initial list of things that you want and need. And then over time, as you meet with different vendors and view their demos and read about system capabilities, you can actually change that and adjust that as you learn. You can also include budgeting information so that you can be disciplined about that as you're talking with different vendors, even if you are looking at different types of pricing models. You can have an idea of what you're willing to spend and what you expect to get in return for that investment. So the fifth step I recommend is that you cast a wide net. So one of the mistakes that we've seen some of our clients make is that they get nervous about the idea of choosing an EHR, and they rely mainly on their local peers or on friends of the practice owners to decide which systems to consider, and they will just assume that something that works for a trusted colleague is going to work well for their practice. Now, there are a couple of problems with that. First of all, it really limits the consideration set right from the start. And, sometimes the system, of course, won't be as good for your practice as it was for your colleague's practice. Or sometimes your colleague ends up being unhappy with it, and they're just, happy with it at the moment. They really didn't do enough research either. So it's really important at the start of the process to cast a wide net. Now, by the way, this reminds me of another important point, which is that you really have to allow yourself enough time to do this process justice. Because, if you already have an EHR that's working, or you already have a workflow, a paper-based workflow that's working, it's much better to take the time needed to make a good choice than to rush it, right? Because there's just a lot to consider here, and you definitely don't want to have to go through this process of converting more often than necessary. So give yourself 3 to 6 months to actually go through this whole planning and evaluation process. So with respect to casting a wide net, it can be hard to know where to look, right? That's another reason why people tend to rely on their colleagues and their peers. But here are some ideas for where you can, to get started to kind of expand your net. And these include specialty societies. There are a lot of different systems that are mentioned or that may be connected to your different to your specialty society. There are also, of course, discussion boards sometimes where you can actually reach out to people in the same specialty who are not in your local area. There are, of course, lots of different magazines and websites that talk about choosing an EHR and that have different surveys that they do. That, of course, is the next point, survey research, both done by magazine and also magazines, and also done by independent groups like the Black Book, for example. They do a very useful survey. And of course, your other vendors can even help you, expand the possibilities that you're looking at, because they may know which EHRs, for example, might integrate with your practice management systems. You talk to the PMS vendor, or your payment technology vendors. If you have estimation technology or credit card on file technology, those vendors may be able to give you some of their feedback on what systems their other clients are satisfied with. And of course, you can also go, as I mentioned, to social media. There are user groups, there are tech experts, consultants, even your billing service, if they work with multiple clients, may have some great ideas for you as far as what systems have, brought satisfaction for their other clients. So once you've cast a wide net, now the challenge is to narrow everything down, right? And so you want to be really, really disciplined and systematic about this too. And one of the best ways to do that is to create a team from different parts of the practice. Now, this can be a challenge, of course, if you're a solo practice and there aren't that many people actually working in the practice. But even if you're a solo practice, you can still usually involve someone from the back office and someone from billing or from the front office, from the front desk, for example, to compare the EHRs that you're considering against the current system that they're using and against the requirements that they have contributed, to the overall plan. So you want to review what you're seeing from your vendors, both in terms of their responses if you do send them the RFP document. Of course, most vendors have websites that have lots of different information, and you can learn about some of the features that you're most interested in through those websites. And many of them have self-service demos, which can be a great way to start, because here's the thing. You're not going to want to get everybody on the team to witness a full-scale demo until you're pretty sure that you have narrowed things down to just a few good candidates. So these self-service demos that everyone inside the practice can take a look at on their own time, rather than coordinating everybody and coordinating even your physicians to come and look at a full-scale demo. Those self-service demos can be a big time saver, and they can help you really see if the system looks like it's going to make the cut for what your needs are. Now, once you've really narrowed things down to just a couple of candidates, it's wonderful if you can see your top contenders in a real practice. This is not always that easy to accomplish, because sometimes it's just hard for vendors and for you to find people nearby who are using the same system and who are also willing to actually let you come in and, peer over their shoulders. But it's always worth asking, because if you can make it happen, it gives you a chance to really see the system in action with a real practice. And then, even if you can't do that, of course, you want to have references from real users. And ideally, the vendor will be able to provide you with some names of people who are actually using the system in your specialty. So the next thing I want to recommend is that when you're getting down to your last few potential systems, you want to evaluate what I call the quote-unquote partnership potential. And by that I mean, will that vendor be at your side as you are, going down the path towards all those strategic initiatives we talked about? You're thinking about adding on telemedicine, or you're thinking about becoming a patient-centered medical home. Will that vendor be there to help you with that? Will you have a point person who will help you through the conversion process? That's really something very important to know. And you need to understand the details of training and support. One of the things we see very frequently with our clients is that there is training and support to be had, but it's not necessarily well publicized by the vendor. So you need to know that you're going to have somebody that you can rely on, that you can reach out to find out what new things have been rolled out, so that you can potentially take advantage of those. Sometimes we've actually worked with practices that had no idea that things like automated reminders or really easy-to-use demographic lists were actually available in their systems, or were available to be added on at a nominal charge, because they just hadn't kept up, and there was really no one from the vendor that was assigned to reaching out to them or staying in touch with them on a quarterly basis or every 6 months to let them know what new things were available. So understanding the details of training and support is really important. It's such a key to actually being satisfied over the long run with your system and getting the most out of it. So the last step that I recommend is that you don't shy away from getting legal or business help. And, some of this help can happen even before you've really narrowed things down, because oftentimes you can get a boilerplate contract from a vendor. Many of them use the same contract for everybody, and you can review it. And then if anything on it is, seems funny to you or something that you're not comfortable with, you can ask your lawyer for some assistance with that before you get too far into the process. Some of the things that sometimes stand out as issues are the ownership of data. You want to make sure that you always control all of your data. Of course, you want to know what kind of support is available, and then, are there protections for HIPAA, and what kind of mutual indemnification is included. The other thing is that you want to make sure you understand, and if you're not able to do this analysis yourself, or you don't have enough information to think through what are the strengths and weaknesses of the different vendors that you're looking at, it's great to get some outside help with that. For example, is the platform you're considering well-funded? Is it likely to be around in 5 or 10 years? Is it likely to have the resources needed to make the investments that they're looking at in their roadmap, right? Those new features that were so important to you. Understanding the business strengths and weaknesses of the vendors that you're considering is a really important step, something that you might find it useful to get some outside help with, though. And with that, I'm just going to sum up briefly. By the way, I should have mentioned that this is a 2-part webinar, and it's in a slightly shorter format than you might be used to. The idea here is that you don't have to carve out such a huge part of your day to attend. The second half will be about implementing. After you've made a good choice, how do you implement a webinar? How do you implement an EHR for maximum success and satisfaction? That will be coming up in March, and everybody will receive an email about that within the next few days. So just to sum up here, these are my 7 recommendations for how you can, go through the process of selecting new EHR without, without jumping out of the frying pan into the fire. The first thing is to make sure you invest the time needed to assess the status quo carefully, look at the good things as well as the bad things. Make sure that you're considering your future needs, not just your current needs. Think about your overall tech infrastructure and how this choice might impact that and allow you to make some other steps that you've been considering. You create an RFP-style document just to use as your own internal roadmap and to share with those vendors who are willing to work with you that way. Make sure you're casting a wide enough net at first and not inadvertently excluding systems that might be really good fits for you. Make sure you're using your entire team so that you can efficiently narrow that big initial set of candidates down to a shorter list. And then finally, don't hesitate to tap into external expertise to make sure that you're actually not going to be tripped up by any gotchas, as you get towards the end of the process. And with that, I will hand it back over to Christina.
Thank you very much, Laurie. Great job, and thanks for outlining those 7 steps. Very important and very easy to follow and understand, so appreciate that. So what I wanted to cover, just take the next couple of minutes here to talk a little bit about Care 360 Solutions. So the slide that you see here is really our brand promise, what we do, why we do it, and how we do it. So what do? We streamline your practice. How we do it? With technology solutions that increase your efficiency. And why do? We do it so you can focus on the health of your patients. So I'm going to talk a little bit about how and show you a little bit how that we do that. So the first slide here I have is really about Quest. Most of you may be familiar with Quest Diagnostics. It's a Fortune 500 company. We're focused on improving the health of patients through diagnostic insights, and we help turn these insights into action. And some of you may be aware, maybe not, but Care 360, as we've introduced here, is the healthcare IT solution at Quest Diagnostics. And we connect more than 300,000 physicians in 90,000 locations via the Care 360 platform with our collective healthcare IT solutions. And we have a very broad-reaching footprint in the U.S., and we are a valued and well-known brand in the market. So this slide here really is showing our holistic solution to managing your practice. And the illustration really is about how our solutions work together to provide 360 degrees of connection and support. And I'll provide you an overview of our core solutions, our electronic health record, our practice management, and also our revenue cycle management solution. So first, let me just show you a little bit, or talk a little bit about how we've grown over the years. We started as a Care 360 lab solution, and we designed it to help ambulatory physicians place lab orders and review results electronically. While e-prescribing, which is the next solution that we developed, was to write and manage prescriptions. We also now, our e-prescribing solution includes e-coupon, and that's a solution that automatically displays manufacturer incentives when they're available to share with your patient. And then once we developed our labs and meds solution, it was so popular that our clients continuously asked for the ability to chart patient encounters using Care 360. So we listened to the voice of our customers, and then we created the Care 360 EHR, which is a fully cloud-based solution. So our electronic health record, which you see here, again, it's a fully mobile and also a fully cloud-based solution, and it allows our clients to access patient records anytime, anywhere, without having an internet connection. With an internet connection. And then referrals and secure messaging are also available to coordinate care between providers and patients, and it can also be used with our patient portal, our MyQuest patient portal. And you can also rely on our secure mobile access via our iPad or iPhone or Android apps as well. It's fully ONC certified. And Laurie had talked about Black Book. We have also been award-winning. We've been highly rated in customer satisfaction with industry third parties such as Black Book, and also CLAS. CLAS is another one that goes out and measures healthcare IT technology companies. So we also have a practice management solution, and this allows you to efficiently manage the flow of patients and help productivity. And our solution does include a dashboard, which provides you a view to maintain a clear picture of your practice's performance. And there's comprehensive calendars are included to help an office stay organized, and having information that's automated through the appointment scheduler and email reminders as well. And then lastly, our revenue cycle management solution really brings it all together. It's our newest solution that we offer, and it provides you with a team of billing experts who may help you maximize collections and revenue by helping you do the work or doing some of that work for you. And this again allows you to focus on your patients. So we provide a team of billing professionals who will assist in handling billing needs, from billing claims to denial management. Also, just given the ever-changing healthcare landscape, the certified coders and experienced billers offer a lot of knowledge in various specialties and with insurance payers. Also, as I mentioned, with the practice management solution, you also have the same access to this dashboard for comprehensive reporting, so you'll always know where you stand, and denials are thoroughly and continuously worked until resolved. And our solution is fully compliant with HIPAA, OIG, and ICD-10 regulations. And best of all, Care 360 scheduling, practice management, and the electronic health record, those are all solutions that are included in the revenue cycle management fee. So it's just a percentage of your collections. And very quickly, just community reach. So our solutions span far beyond just the ambulatory space, and we do allow you to coordinate care and share data across the healthcare community. So given our broad reach and the robust technology, we're able to integrate providers and technologies across the landscape while supporting and sharing insights. So through our solutions, you can send patient information in a CCDA industry standard format, accept information from other providers, and also access extensive patient lab histories to optimize care. Also, easily and securely exchange patient health information using the direct exchange with those that are in the Direct Trust accredited network. So we've got the ability to reach out to the community. And then really lastly, just investing in a true partnership. When you invest in Quest, I hope you know that you can be investing in a trusted, experienced partner that will excel at meeting your needs. And you can be confident in knowing that you're partnering with a financial stable partner. Also, again, I think the fact that confident knowing that our EHR has been ranked #1 year over year by Black Book, which is, as Laurie mentioned, it's a globally recognized source of unbiased market research and customer satisfaction, as well as a leader in class in the 1 to 10 physician space in the ambulatory market. So overall, again, we've got a dedicated team of professionals who are ready to embrace and support the needs of your practice and people with 24/7 support. And so you'll gain access to that extensive network. And one last thing that, I wanted to make sure people knew that I had mentioned that we were ranked highly in class in Black Book, and I had pulled a couple of quotes, recent quotes from the third-party class organization that we have access to. And these are just a few comments that speak to our solution around how it's easy to deploy, easy to use, and the integration of the EHR and PM. So if you're looking to compare your current EHR to Care 360, one of our on-staff regional directors can help you do that. And we've provided here a list of resources. So Laurie has a website, a blog, a Facebook page, and some specific articles and information. We also have some articles that Laurie has written for us, some white papers. A white paper will follow this webinar. Along with, as Laurie mentioned, we have a second part webinar series coming up on March 20th.
Healthier outcomes are now easier to embrace. We know you run a busy practice, and efficiency is top of mind. Discover 360 degrees of connection and support. Keep your practice on solid ground with a cloud-based EHR.
Care 360 offers a full and fully mobile EHR that helps keep medical practices efficient and profitable,
while connecting to the larger healthcare community.
Join the network of over 300,000 Care 360 providers in 90,000 locations and connect to other healthcare providers as well.
Coordinate care to and from anywhere.
Care 360 integrates providers and technologies across sites and care settings,
while seeing and sharing the bigger picture.
Care 360 allows you to send patient information using the CCDA industry standard format, accept information from other providers, and access extensive patient lab histories to help optimize care.
Meet meaningful use requirements.
Care 360 EHR is ONC certified to qualify for meaningful use,
while exchanging data simply and securely.
Physicians collect and share data with other EHR users to meet industry requirements with Care 360 Data Exchange.
And with new Care 360 Revenue Cycle Management, you can maximize collections and revenue.
Care 360 provides you with a team of billing experts to take complicated billing issues off your plate, allowing you to focus on what matters most, your patients,
while reducing your administrative burden. And that means more time with patients. Care 360 also offers many other great advantages. Boost patient engagement and compliance with MyQuest.
Patients can view and share vital health information with their healthcare providers.
Elevate patient conversations with interactive insights.
Enhance lab results with diagnostic insights, accessible in Care 360 and to patients through the MyQuest patient portal.
That's 360 degrees of connection and support, and healthier outcomes for all. Care 360.